Hello, everybody. This is Jeremy McGovern, and I'm the publisher of American Farriers Journal. And I want to welcome you to our webinar tonight on laminitis, causes, risk factors, prevention, and treatment. First, I'd like to thank our sponsor, Icehorse. And for over 15 years, McKinnon, the manufacturer of Icehorse, has set the standard for equine cold therapy. And their mission is to bring you innovative products designed to help prevent injury and speed recovery for equine athletes. And I welcome you to go to their webpage to learn more about them at icehorse.net. Tonight's presenter is Dr. James Orsini. He's the Associate Professor of Surgery at New Bolton Center of University of Pennsylvania's School of Veterinary Medicine. He's the director of the Laminitis Institute there at New Bolton. He is a member of the College of Veterinary Surgeons. He's the author of dozens of papers and is a member of the International Equine Veterinarian Hall of Fame. And on a personal note, he's very kind and giving of his knowledge and insight. So I really do believe we're in for a treat tonight of getting some great information from a terrific presenter. But before I turn things over to Dr. Orsini, I have a couple of housekeeping items. On your screen, there is a control panel with a Q&A icon. You can submit questions here at any time during the presentation. You can just type those in. Time permitting, we will look to answer as many questions as possible following the presentation. You do have the option to submit questions anonymously by checking the box. It does read submit anonymously. And if for any reason your internet connection or even our connection happens to fail at some point, it looks like the webinar has been interrupted, just go back to the email that you received earlier telling you how to join the webinar, and you can re-enter that way. Also, as a reminder, this is a recorded session, so if you happen to leave or for some reason any of it cuts out, don't fret. We'll send you an email tomorrow with a link to this recorded session, and that will include the Q&A. Okay, so I think we're ready to start. Again, thank you for joining us tonight. And Dr. Orsini, the floor is yours.
Thank you, Jeremy. I certainly want to also acknowledge Jeremy and Farriers Journal as well as Icehorse for allowing me to interact. And I think this is a two-way conversation because you'll find I always come away learning more than actually I think I share with my audience. So thank you for wherever you are this time of day or evening. My plan is that I'd like to kind of give you the big picture view on laminitis. You can see that the topics certainly are quite broad and quite involved. And so in this short period of time, my goal would be is to give you what I call the essence, the heart of the matter, which I hope will generate questions. And from there, will actually pique your interest in learning more about that. And certainly, I am always more than happy to respond to questions, both as part of the webinar, but certainly at some time in the future, you can always contact me by email at orsini@upenn.edu. So we'll go from there. And Jeremy was very generous in his introduction, so we won't spend any more time. Clearly, laminitis has been something that has been a passion of mine and certainly associated with my surgical practice here at the University of Pennsylvania, because unfortunately, laminitis in many cases is a complication that we see relative to a number of problems. And for that, I want to spend some time talking about the initial causes, the types, and then what we can do. I think you'll find as we talk about this topic is that prevention really is probably the most important thing that we can try to do, because treatment certainly can be successful, but it is usually a lifelong process that requires considerable time, expense, and energy in doing that. If we look at the foot, and I always think of the foot as kind of almost a separate organ, because when you think about it, it's made of the integument, the skin, that's the hoof wall, but also the core, the skeletal system, the coffin bone, and the second phalanx, and then everything in between, the circulatory system, the nervous system, and then that tissue, that very important tissue, that lamellar tissue, that's that bond that actually provides that glue between the hoof wall and the coffin bone or third phalanx. And so when you look at the complexity of it, it's amazing that horses don't have more problems when you think about these fabulous racehorses like a Justify that runs at speeds of 35 to 40 miles an hour, and yet the foot remains intact. And that's the beauty of the foot itself. So it's a great organ system. It's a great piece of the anatomy, and it's unique to the horse in the sense that the speeds and the wear and tear on the foot is quite substantial, and yet it is quite durable and resilient. If we look at the normal metabolism, the foot actually uses more glucose than the brain. Now, I've heard people talk about the brain of the horse being very small, but really, in essence, when you think about it, the amount of energy that foot uses is really quite considerable. And this is certainly done by a process called glycolysis, which is really nothing more than breaking down sugar into more basic substances that can be used by the tissue in the foot. The epidermal or insensitive lamina, in fact, probably uses glucose differently than it does in other parts of the body where insulin is an important part in driving glucose or sugar into the cells itself. So again, you'll find that the foot has some very unique characteristics that makes it quite a remarkable system itself. And more importantly, that interface between called the epidermal and dermal lamellar tissue, or commonly known as the insensitive and sensitive lamina, is so important. And glucose actually is that important ingredient that provides the energy and the connection between those basal cells and these two layers of tissue. So that's what actually provides that bond. And if you take your hand and take your fingers and put them together, that's basically what the epidermal and dermal lamellar tissue is. And so when that bond is intact, it actually gives and takes. But when it fails, what results is that the bone actually then either rotates or actually sinks. And the blood supply, as you can see here, is quite robust. It comes from two major vessels. These palmar in the front or plantar vessels come down and actually provide a network of vessels to both the sole, and that's the circumflex arteries of the sole you'll see at the bottom here, and then the coronary arteries or vessels up here that supply this here, and then you have the vessels that come in the back. And with that, then there are interconnecting veins that actually drain the blood. And the thing that's interesting about the foot is that it actually, the veins in particular, is that they have no valves. Most veins in any other part of your system or horse's system have valves so that as blood is pumped back to the heart, it doesn't flow backwards. But in the foot, all the veins all connect. And so this is also important in actually when we perform what's called a venogram. And a venogram actually gives us a picture of the vessel. So the blood supply is quite robust, quite complex, and quite important to the integrity of the foot itself. When we look at laminitis, we can break it down into three major causes or etiologies. One that creates the most acute and devastation to the foot is called the inflammatory or a systemic inflammatory response system. You'll see the acronym SIRS, S-I-R-S, which talks about this inflammatory process. And we'll talk about that a little bit more. The second one is the equine metabolic syndrome. And this is a syndrome similar to what we see in other species and people as type 2 diabetes. And the horse, again, is unable to respond to insulin, becomes insulin resistant. We'll talk about that in a moment as well. And then finally, the support limb laminitis. And this is one that we see in orthopedics where one leg is injured, a severe fracture, for instance, and then the other limb takes an overload or a burden of that while the other one heals. And what happens over time is that the foot, the supporting limb, foot starts to fail. There's one fourth one too that sometimes you'll hear about called road founder or repetitive injury, and those are horses that run on hard surfaces and constantly have concussion to the foot and fail. But for our purposes tonight, if we think about pigeonholing these three causes, I think will be much easier to see how the puzzle fits together. So one further step is each of these three all result at some point to an inflammation. And you can see in this figure here, this reddened area here is where the lamellar tissue becomes inflamed. And that's where laminitis is. The itis of that is the inflammation. And when that becomes inflamed, those bonds, that tight bond, and the basal cells and basement membrane start to fail. And that's when you start to see the rotation. And when we see the rotation radiographically, you'll hear the term used founder. And founder really designates a radiographic change where the coffin bone is actually rotated or dropped and is no longer fully attached to the hoof wall. And so that's important. And what we hope to do is try to recognize this disease before we get that failure that occurs. So let's talk about each one in just a little bit more detail, just so you have a better understanding of the three major causes. So the systemic inflammatory response syndrome, or SIRS, as I mentioned, the acronym, is a disease or inflammatory process that occurs systemically. And so there are 3 or 4 important types of diseases that usually result in this systemic inflammation. The horse with colic and has, for instance, a twist of some intestine. That intestine dies and creates inflammation that then becomes systemic. And the foot is kind of what we call the target organ. This is where these inflammatory mediators from the inflammation target the foot itself. And in people, it's the lung or the liver. In the horse, it's the foot, the lung, and the liver. But the foot in particular is the one that fails. And the horse with a retained placenta, similar to that too, also has a severe inflammation that causes the systemic inflammatory response. And then the third example is the horse with pneumonia or pleuritis, where they actually have an inflammation of both the lung and the lung tissue surrounding it, the pleura. That's called the pleuritis. So these diseases can lead to systemic inflammatory syndrome. And one of the things we know is that there are some very specific signs that occur with that. And generally, these animals are febrile. They have a temperature that may breach 105 degrees Fahrenheit or higher, or sometimes if they're really in a debilitated state, the temperature actually can go down. So it can be below 98 degrees Fahrenheit. Usually the heart rate's elevated too. A normal horse will have a heart rate of 28 to 40. These horses generally have heart rates in excess of 60 beats per minute. And you'll see that they are breathing faster. They both hyperventilate, take bigger excursions of the chest, or they're breathing more rapidly, called tachypnea, and that is trying to blow off more of the CO2 that's built up in the lungs. And you'll find if you run laboratory, your veterinarian runs a laboratory test, that the white cell count can either be very elevated, or in fact, if they're losing white cells into dead tissue, it can actually be very low. So these are signals to us that these individuals are at risk for SIRS and need to have something done to protect their feet. As I said, you'll see the causes listed here on the left-hand side here of part infection, endotoxemia, trauma, and the list goes on. And this picture here is a horse actually that is being prepared for colic surgery and is placed under general anesthesia. So so you can see it's a very acute, very rapid occurring disease that can target the foot and result in failure of the foot at a very rapid rate. So these horses need to be treated and aggressively to prevent the disease. The equine metabolic syndrome is something that has become much more commonplace for a couple of reasons. One, everyone, like in human medicine, healthcare is gotten better over the last 20 or 30 years. And this is certainly the case for horses as well as for humans. And so what we now have, we have an older population of horses that in fact are maybe less active, still eating what they had. And of course, you can see this horse here that clearly has a tub full of apples and oats and other grains, along with some carrots, of course, which are good. But what happens is that these horses become less active. They're still being fed the same way. and they start to put weight on. And what happens is, like in people, they become insulin resistant. So in other words, their ability to manage sugar becomes dysfunctional. It's actually a dysfunctional problem that results in laminitis. And this is much more insidious. In other words, you don't see it right away. It may take weeks, may take months before you actually notice. So it's something that you have to be aware of. And we talk about prevention, we'll talk about what we can do with that. And again, as I said, it's usually they have sore feet, but it's manageable. It isn't something where they become crippled. And as I said, it's insidious and usually results in something in the inability of insulin to respond normally to glucose. Not all horses that are fat are necessarily at risk for this. In fact, some horses will actually have fat in their abdomen and look externally as if they're in great shape, and yet they can be, in fact, at risk for that as well. So diet is an important part of that. Maintaining weight and maintaining activity are all things that we'll talk about in a little bit more greater detail. So again, think about the older horse, the horse that's less active, the horse that may be a little bit overweight, are those things that you should be thinking about, and at least maybe as part of your annual health care with your horse is that may be tested in advance in order to try to be proactive rather than to reactive. And finally, the last group is those that are the supporting limb laminitis, and those are the ones, again, that have a severe orthopedic injury. And the classic one that I think most people remember is Barbaro, who had a severe injury in his one of his hind limbs, a fracture, and developed laminitis in his support limb and then ultimately in his front limbs. And again, what happens is that these horses place a disproportionate amount of weight on the good leg in trying to protect the injured leg. And so knowing that, there are things that we can do to try to help to protect that leg, but most importantly, trying to address the primary problem. We think that this is a little bit of a different variation from the other two where I talked about inflammation. We think that actually there's a vascular problem. And if you look at this lower right-hand corner here, you can see this is what's called a venogram, where we inject a dye into a vessel that supplies the foot, as I showed you in one of the earlier slides. And that dye is unable, the blood is unable to carry that dye into the foot. So basically what you're doing is you're starving the foot of oxygen and glucose, the things that they need to survive. And so what happens is that over a period of time, usually several weeks, about 3 weeks seems to be about the average length of time, the foot starts to fail. And this is what it would look like in that. And certainly the horse here, again, would be an indication here where it had a severe injury of the left front limb and then overload the right front limb. So again, what you want to do is you want to nurture the good foot. You want to try to treat the bad foot as best you can to try to provide stability, but also to take good care of that other foot by trimming, using support wraps. Again, this is where your farrier is so important in the whole process as part of the team, is making sure the foot is trimmed appropriately. One of the things that we notice in some of these horses is that they develop an overgrown or unbalanced hoof. And what this does is it just increases the stress and the strain on that lamellar tissue, that support mechanism that supports the coffin bone. So the horse with a long toe and the low heel, that increases the pull on the coffin bone. And then over time, if they have a support limb problem, what that does is that eventually it starts to fail. So again, thinking about protection and prevention are important. And also, I mentioned here road founder as sort of the fourth potential cause. And this is, again, where a horse is on hard footing and constantly re-injuring or creating concussion to the foot. This over time also leads to failure of the foot as well. But we sort of keep that as a separate category that has some overlap with support limb laminitis as well. But again, those are the three major groups that you need to think about with laminitis. What about detection and treatment? again, thinking about the early warning signs, I think, is probably most important. One, identifying the horse at risk, the overweight, inactive horse that's still eating a lot, the horse that's injured, and the horse that has some sort of systemic disease, inflammatory disease, as I mentioned, such as pneumonia, colic, retained placenta. But if you look at the foot itself, one of the things you'll find is that with inflammation, you get these bounding pulses, these pulses that are very easy to feel on the back of the pastern and at the level of the fetlock. The foot, again, will change in temperature, but a horse that has a laminitic episode, the foot will remain warm. So it actually is almost hot to touch because of the inflammation. And you'll see in some of the chronic ones in this picture here, they get these divergent rings. And you can see that normally these rings should be symmetrical from inside the foot to the front to the outside. And this is a case of a chronic horse. And you can see how these rings or lamellar lines here, or hoof lines that have changed over time associated with the interruption in growth. And if you look at your own fingernails, you'll see how they change with diseases and with other events that occur in your life. The horse's hoof is a tremendous roadmap to give you a picture of what's happened over a period of time. Again, so looking for those distorted or divergent hoof rings. Increased heart rate. Again, remember, take the pulse of your horse, know your horse. I think owners are some of the best guides in helping veterinarians and farriers understand what's going on, knowing what the normal is for that particular horse. You see a horse that constantly is shifting their weight. Normally they will shift their weight on occasion, but a constant shifting tells you that they're uncomfortable and that they are trying to get off the foot that hurts the most at that time. Sometimes you'll even see some bleeding along the white line or along, I think, at the sole. Check the insulin level in the older horse that's obese, and if they have any inflammatory diseases such as diarrhea, some other infection of pneumonia, or some other inflammatory disease. These are warning signs that those horses could be at risk for laminitis. So what do you do as far as trying to prevent it? And one of the things that we know and we talk about in medicine, evidence-based information. This is information that has research that supports the outcome. So we know that it actually works. And so we take it from basically laboratory to the bench or to the barn in this case and use that. And one of the things that I think has really helped us to better manage and prevent as well as treat laminitis is the use of cold therapy or cryotherapy. All right. And so this is basically using cryo is the Greek for cold, cryotherapy. And generally these horses that are at risk should be treated for some 72 hours. And the horse's foot is quite responding to that, and that it can actually take temperatures that are down below 10 degrees centigrade. And that's now, you're talking about temperatures in the 30-degree Fahrenheit range. And if you think about putting ice on your hand or arm for any period of time, you know that you can't tolerate that for very long periods of time, yet the horse's hoof is remarkable in what it can sustain. We've had in our experimental studies temperatures down to 3 degrees centigrade, just above freezing, and the horse's hoof never develops, or the skin never develops frostbite. So it's quite tolerant, well tolerated, and very effective in cooling the foot. We know that protectively, in other words, preventing laminitis, that maintaining temperatures of 10 degrees centigrade or less seems to be protective. And so that's our goal. And the system that's out there, there are a number of systems that are out there that are used, but it needs to be continuous. And the one system here that's demonstrated on this horse is the ice horse system, which has these malleable ice packs that actually fit to the hoof and the pastern and actually provide that intimate contact that is so important in preventing and managing a laminitis. And so safety is certainly an important part of it, and clearly this is something that the horse tolerates well. Besides certainly the foot, you can use it for other soft tissue injuries, certainly after hard works, you'll find that many trainers and owners will actually use cold therapy on tendons, and tendons again are quite resilient and quite responsive to cold therapy as well. So besides the foot, cold therapy can be used for a number of different treatments. Prevention, again, as I said, thinking about the big picture, and again, thinking about the risk of that particular individual. And I think, individual medicine is something very important in the human side as in veterinary medicine, and your horse certainly falls within that. So if you think about those horses that are at risk, think about the horse that is overweight, the horse that has that cresty neck that seems to develop or evolve over time. Those are early signs. Carrying a little extra weight over their back or rump, or over their triceps or shoulder area. Those that are easy keepers, again, are others as well. So again, you got to be thinking about the combination of things. So check their diet. Make sure they're getting what they need in the amount of energy, but not more than they need, all right? Because that's important. So diet is critical. If you make changes, make them gradual, all right? Because one of the things that we know is that these sudden changes in diet certainly can disrupt their intestinal tract and cause such things as diarrhea. If they need a little extra energy, there's nothing better than a little vegetable oil, but you don't want to overdo it. No more than 2 cups. Generally, 1 cup is usually enough of vegetable oil added to their feed can actually provide extra diet. If you give them too much, they'll end up having diarrhea. Prevent those horses that get into the feed bin, all right? Those are the ones that clearly are at great risk for developing laminitis, because what it does is it affects the lower gut, and it creates an environment that allows these bacteria to escape from the intestine and then target the feet. So you want to, again, be very careful about that. And certainly, depending on where you are in the world, the grass is a very rich source of sugars, and fructans in particular are very rich and complex sugars that actually can lead to laminitis. So very early in the spring, when the grass is really lush, you want to be careful. Again, reintroduce them slowly to grass. If they have a tendency to put weight on easily, use a grazing muzzle so they only get a little bit, all right? And so generally midday is when the grass and the sun is at its peak, and usually the sugars are greatest concentration there as well. And again, finally, relative to diet and nutrition, is test your hay. Even the worst looking hay, in fact, can be very high in non-structural carbohydrates greater than 10% or 12%. And so you want to make sure that your hay is not a source for these sugars as well. And so I always say, if you get a large delivery of hay, take the time to test it and actually get a sense of what the quality of that particular hay is. And finally, when we look at prevention, I think this is part of both healthcare. So normal deworming, again, things that stress the horse are important. Again, preventing them from diseases that are preventable, like rhinopneumonitis, influenza, all those things that can, again, stress the animal and put them into an inflammatory state. And during the routine checks, certainly if the horse is at risk, talk to your veterinarian about testing for insulin, for instance, or doing a panel for insulin resistance, and even for Cushing's disease. Again, this is an opportunity to develop that partnership with your veterinarian in doing things that can be very critical to it. And then certainly your farrier is a critical component of this team all the time. And so your farrier probably knows your horse's feet better than anybody. And so they can maintain that good foot and try to, again, prevent those situations where the foot mechanically then puts the horse at risk for failure. All right, so good trimming and talking to your farrier about how often they should be trimmed is important as well. and then the type of service they're working on, trying to minimize excessive concussion that actually damages the lamellar tissue. And so I think in closing, I think the message I like to leave with you is that partnership in managing a horse is a combination of you as the owner, your manager, your veterinarian, and your farrier, and anyone else that's involved in them at some level are all critical in understanding what they can do and their role in trying to recognize those horses at risk and prevent the disease. And with that, I'd be happy to take any questions, and thank you for your time and attention.
Okay, thank you, Dr. Orsini, and we'll get started with the Q&A portion of the program. We have a few interesting questions come in. Again, if you notice on the toolbar, there's a Q&A icon there. If you click on that, you can type in your questions. And like I said, we already have a few in, and I think an interesting thing is we got a nice sampling of some veterinarians, farriers, and horse owners. So we have quite an array of questions. For the first question, Dr. Orsini, what advice would you have for the farrier who maybe in an acute onset of laminitis has an owner they need to encourage to bring in the vet? What strategies or tactics would you have for them to get a less than active owner more engaged with their horse's health?
That's an excellent question, and certainly one of the things that I think goes back to having that partnership both with the veterinarian farrier and the owner, so that they all feel like they are working on the same team. You know, one of the things that I think is most frustrating is that sometimes the owner, the farrier, and the veterinarian are working in silos instead of working together. And so I think this is a matter of good communications, and I don't think there's anything magical that I can tell you other than I think the importance of stressing to the owner the value of having a veterinarian and a farrier working together, because I think they each can provide their expertise that will ultimately be hopefully important in one preventing and if need be treating a horse successfully with laminitis. So communications I think is really the key here, because you may need radiographs. Certainly if there's any question about whether this horse is laminitis, I think you need to get some baseline films and some baseline laboratory tests to try to decide, one, if you don't have laminitis, is this horse at risk for it, and what you could do in the way of cooling or cryotherapy, and if it does have laminitis, what you can do both from a medical as well as from a mechanical standpoint, where the farrier and veterinarian are needed together.
Okay. In terms of routine veterinary care or a physical, do you suggest that on a yearly basis, or how frequently should the owner get a checkup on a seemingly healthy horse?
Yeah, I think you'll find that, like anything else, as the horse ages, I think that probably, you know, the annual physical and routine blood work is probably in order. And I usually say those horses that we know that, for instance, that Cushing's disease can occur as early as 8 years of age. But generally, we don't see this until they're in their teens. And so probably when they're younger, you know, probably other than some of the routine care as far as teeth and vaccinations, that, you know, maybe every other year or so, laboratory work can be done. And I think this is really having your veterinarian know you and know your horses can give you the best advice as how often it should be done. But clearly, as they age, their risks go up relative to things such as insulin resistance, as far as Cushing's disease, et cetera. So that's something that I think you and your veterinarian can determine as to the best schedule for where you are relative to the part of the country or the world, and what is best for your particular stable.
Okay. Do you have any experience of laminil, and do you have any comments on it?
It's a product that's been around for quite a while, and it's a cytokine inhibitor. It has some limited application, I think, in the early stage of laminitis. Unfortunately, there hasn't been a lot of research on it that actually has shown the fact that it can prevent laminitis. I think it has some role, but I think it's still too early to know whether laminil itself is going to be the silver bullet. I think it may be a component of treatment, but at this point in time, the research studies are still lacking to provide the evidence that we need.
Okay. When discussing EMS, you mentioned horses that look externally fit, not overly obese. Are there certain types of breeds that are more typical, or in other words, at a higher risk for EMS that may or may not look like it from the outside?
Yeah, excellent question. And I think the answer is yes. I think some of the Morgans, some of the Arabians, who can be, especially the Arabians, can be very fit, and yet they're a group of horses that seem to be in that risk category. And so I think clearly there are breeds such as the Arabian and the Morgan that are at a little bit higher risk, and certainly even though their body condition score looks to be excellent, they still can have other fat deposits that may not be evident externally and need to be evaluated by laboratory testing.
Okay. What is the prognosis for severe laminitis with rotation and chemically separating? I'm sorry, jumped on me. What is the prognosis for severe laminitis with rotation and sinking induced by sears? Can these horses be saved once the causative factor has resolved?
And the short answer is it all depends on how many feet are affected. What I've seen with some of these horses, for instance, those that have sears, say associated with Potomac horse fever, my experience has been that many of these horses, and talking to my colleagues in internal medicine, is that it's such a rapid onset that many of these horses develop laminitis in all 4 feet, and these are the ones that, in fact, generally are more likely to sink than to rotate. So, in answer to your question, I think the number of feet that are affected, if it's sinking, I think sinking has a poorer prognosis than rotation. And if it's certainly 1 foot, I think that of the 4, certainly as you might expect, that those certainly carry a much higher prognosis. So depending on the disease, the number of feet affected, and whether they're sinkers versus rotators, all impact the prognosis. So basically, more feet affected, more of a sinking, and the more peracute, the poorer the prognosis.
Okay. Is there a time frame from the onset to being stable for shoeing or support of some type?
Another good question. And so it would depend on the type of rotation or sinking they have. Generally, the rotators, you may have some interim mechanical support, whether that be some sort of a boot or whether it be some sort of a glue-on shoe. I think most farriers, prefer to use a glue-on shoe or some support system that is relatively easy to get on and off the horse's foot. One, to minimize the pounding of nails, but if you don't have the materials for a glue-on or for some sort of equine support system, and nailing is all you have, well, then I think you have to use what's available to you. So generally, we may use something as an interim until the foot basically stabilizes. All right. So we certainly think that mechanical support of that foot is a critical part of the treatment, even early on. And so when you start to put something on that's more permanent and durable, it may be several weeks. But I think until you know whether the foot is stable, and basically what you use as your criteria are the following. One, radiographically, has there been no progression of the changes on the radiographs from one series to the next? And that series may be done at weekly intervals, may be done at 2-week or monthly intervals, and I think your veterinarian will be the better person to make that determination based on the clinical signs. Certainly the comfort of the animal, and generally when their comfort level stabilizes and they're on basically routine medications such as phenylbutazone or Equiox as examples of some of the NSAIDs, and that's all they require, then and their heart rate goes down, their respiratory rate goes down, their vital signs start to improve. Those are all clinical signs to me that they are becoming more stable. So once they're stable and the foot itself is not continuing to deteriorate, then something more permanent in the way of shoeing can be devised or developed. Because you're going to find that if they've had rotation or sinking, that there's going to be some change in how they're shod from that point going forward.
Okay. Actually, we have quite a few, probably about a dozen questions here that want to get into shoeing considerations for acute versus chronic laminitis, other considerations about, negative effects of steel, etc. Certainly there at New Bolton, you have a very good farrier with Pat Riley. Maybe could you talk about, from your perspective as the veterinarian, of the work that you do with the farrier in deciding what appliance to use with a horse, realizing there's many different circumstances that will affect that decision?
Yeah, and I think that's where, the veterinarian and the farrier are really partners, and I can't emphasize the importance of that relationship, because much of what I think the farrier does mechanically is dependent on what we see radiographically. And so we use our radiographs as a important means of trying to determine what this horse needs for mechanical support. And so with that, and in the discussions in looking at that, I think you can determine what is the best appliance. And even with some science here, there's still a lot of art that's involved in this. And this is really where experience comes, because we've all seen what looks like to be the perfect shoe to apply to a foot, and yet the patient, the horse, is not any more comfortable. And so you can't always rely on what looks to be scientifically sound if the horse is not any happier. And so this is where I think that the making those adjustments, and sometimes it may mean changing the angle by 1 or 2 degrees, can make the difference as well too, because without something more specific and actually looking at the stress on both the lamellar tissue but also on the soft tissues, many times this is somewhat of a guesstimate as to what is needed too. So radiographs, I think, help guide us, so we know where the breakover is. We know how much of a angle or how much heel we may be able to remove without creating too much stress on the lamellar tissue along the front of the foot, especially knowing that it takes virtually weeks to months for that lamellar tissue to actually heal once there's been a laminitic episode. All right, so that's certainly the way Pat and I work together, is that we use our radiographs as the first step. We look at the foot together. We watch how the horse actually walks. How are they loading the foot? Because the radiographs can only tell you so much, but I think the horse will be much more instructive, I guess, as far as how we move forward by watching actually how they walk and how they load the foot. So you have to use all those criteria, probably plus other things that I haven't even touched on, that will be part of the equation in the ultimate appliance that you use.
Okay. Are there any studies you're aware of in which omega-3s showing that omega-3s prove helpful to laminitis or a high-risk horse?
There have been some, but I'm not. I can't put my finger on anything specific. I know omega-3s have been looked at in other in human medicine as well, but I don't think there's been any full-blown studies. I know they've been, again, empirically, in other words, out of practice. There are those that believe that they have some value, but I can't give you a quote on a particular study where omega-3s have been looked at specifically.
Okay. Are thin-soled or thin-walled horses more at risk?
I think thin-soled horses are at greater risk. I think that if you look at the horse's hoof itself, there are those that may have a little bit of a thinner wall externally, but it's really the sole that, and that's the S-O-L-E and not the S-O-U-L, that is so critical here, because what we try to do is our goal is always to have a sole depth. That's the distance between the bottom of the coffin bone and the bottom of the sole of the hoof to be at least 10 millimeters. And we find that horses that have 10 millimeters or more of sole depth actually are generally very comfortable. Horses that have less than that are usually horses that are very sole sensitive, and in particular, they've had laminitis, even more importantly, to provide some additional cushioning to that sole because of the lack of depth between the bottom of the bone and the bottom of the hoof itself.
Okay. When dealing with laminitic donkeys and mules, are there any other precautions or things to look out for that should be taken that maybe differ from horses?
Yeah, I think you'll find they're entirely different. And actually, if you look at our book, Equine Emergence, we have a special chapter on mules and donkeys because they are a different breed in the sense of how more stoic they are than horses. And so I think that they need a special attention. And in that chapter in that book, you'll get all the information on some of the differences between horses, donkeys, and mules, and some of the specifics related to laminitis.
Okay. How important do you find DMSO in the treatment of acute or acute on chronic bouts of laminitis?
Yeah, I think it definitely, we know that with inflammation we get edema, and we know that dimethyl sulfoxide, DMSO, is certainly useful in trying to reduce some of this edema. So I think in the acute stages, it probably is of value. And again, unfortunately, there aren't any research studies specifically looking at DMSO relative to laminitis. But I think from a practical standpoint, it certainly makes sense in the acute stage.
Okay. Again, there's even more questions coming in about appliances, but let's maybe talk about the new Bolton. What's the go-to appliance that you guys like for an acute unstable case?
Good question. Sometimes we will just use a heavy cotton wrap just to provide some cushioning. One of the things that we want to try to do is protect the foot as much as possible. Again, I think in the acute stage, the goal is to try to address the primary cause, because I think, as we've talked about before, that laminitis is usually a secondary problem. It's a result of something else. And so trying to eliminate the underlying cause is key to trying to get stability. So in the acute stage, we may use many of the commercial boots that are out there. We'll try different different putty elastomers, some that are very soft. And I think one of the things you want to try to do is trying to distribute the weight bearing over as large a surface area as possible, because we know that the hoof wall itself is tenuous at best. We know that that lamellar tissue, that bond, is fragile, and that whatever we can do mechanically to try to protect that foot is important. So, in answer to your question, sometimes we use big wraps. Sometimes we'll use the boots with some of the softer inserts. Sometimes we'll make a putty elastomer and tape it onto the foot. If the foot is stable enough, we will use a glue-on shoe with different putty elastomers again, and even a hospital plate, something along the bottom, so that when the horse is bearing weight, that they're not loading the hoof wall specifically, but again, trying to use as large a surface area as possible. Even some of the, the large boards that we've used, we've glued on again as a way of trying to provide a large surface area. And in some cases, if you have the facilities, and these horses are at great risk for or have more than one foot, sometimes we'll even sling them, put them in a sling and support them that way as a way of trying to unweight and protect the foot or the feet in these acute episodes.
Okay. Could you explain the process of the laminae chemically separating? If the foot uses glucose to make those connections, what makes them let go?
It's usually failure of the basement membrane. And if you look at microscopically, you look at this tissue, there's a membrane called the basement membrane, and they have these things called the basal cells. And these basal cells are very important in providing that welding points that actually provide the adhesion or the security of that basement membrane to the dermal and epidermal lamellar tissue. And so when these cells die, what they do is they basically unplug or leave the attachment at risk. And so what happens is that as these cells die and this basement membrane starts to become less able to provide that connection between the epidermal and dermal lamellar tissue, then the mechanical weight bearing is what usually puts it over the edge. All right. And so, normally the horse can withstand its full body weight on one foot and even at great speeds. But as the integrity of that basement membrane starts to fail because of lack of oxygen, a lack of glucose, or a combination of both those things, plus mechanically loading, then basically it sort of unzips, and that's when you start to get the rotation or the sinking of the coffin bone.
Okay, we're running out of time, so we'll go through a couple more questions. Do you see frequent abscessing with horses that have chronic laminitis but don't reveal signs of lameness when under work?
Yeah, that's one of the biggest, I think, frustrations is the horse with chronic laminitis and the recurring abscesses. And usually it's always probably around the toe is the most common spot, and it's always in most cases related to probably an area that has poor blood supply. And what's happened is that, horses are in an environment full of bacteria that they stand in all the time. And any little crack and separation that you might get in the hoof wall or sole allows a few bacteria to penetrate the sole. And in a normal situation, the horse's body is able to clear these bacteria because it has good blood supply and a good immune system. If blood supply is compromised, then those white cells, those cells that actually are on the front line in removing these bacteria, are unable to gain access to that particular site. And so these bacteria can reproduce very rapidly. And as they produce and multiply, they also release different enzymes and stuff that actually then break down some of the tissue. And before you know it, you have a horse with an abscess. And this is not uncommon, especially in those horses that have rotation, more likely, and you'll find it more at the toe. And it's usually, again, as I said, probably associated with poor blood supply to that particular area.
And then could you comment on laminitis caused by allergic reactions and what some of the causes are there?
Good question. I think it's probably associated with a systemic release of these inflammatory mediators. In people that have reactions, we know that these inflammatory cytokines, these inflammatory mediators, interleukins, and a series of other inflammatory mediators are released all at once. And as I mentioned earlier in my presentation, that there are target organs that are recipients of these inflammatory mediators and become sites that fail. And in the horse, one of the target organs is the foot. And so what happens is we get this tremendous release reaction associated with this allergic response or allergic reaction. You get this cytokine release from the body, and it showers the foot and probably leads to an inflammatory process that ultimately leads to laminitis.